Hi, and welcome viewers of Nursing Academy 101. In this video, we will talk about Nursing Medical Surgical E.N.T multiple choice questions and answers part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A client is diagnosed with a disorder involving the inner ear. Which of the following is the most common client complaints associated with a disorder in this part of the ear? A. Hearing loss. B. Pruritus. C. Tinnitus. D. Burning of the ear. The answer is C. Tinnitus. Question number 2. A client with Meniere's disorder is experiencing severe vertigo. Which instruction would the nurse give to the client to assist in controlling the vertigo? A. Increase fluid intake to 3000 milliliter a day. B. Avoid sudden head movements. C. Lie still, watch the television. D. Increase sodium in the diet. The answer is B. Avoid sudden head movements. Question number 3. The nurse is reviewing the physician's orders for a client with Meniere's disease. Which diet will most likely be prescribed? A. Low cholesterol diet. B. Low sodium diet. C. Low carbohydrate diet. D. Low fat diet. The answer is B. Low sodium diet. Question number 4. When teaching the client about Meniere's disease, which of the following instructions would a nurse give about vertigo? A. Report dizziness at once. B. Drive in daylight hours only. C. Get up slowly, turning the entire body. D. Change your position using the log roll method. The answer is get up slowly, turning the entire body. Question number 5. A client is diagnosed with Meniere's disease. Which of the following nursing diagnoses should take priority for this client? A. Altered body image. B. Risk for injury. C. Impaired social interaction. D. Ineffective cupping. The answer is B. Risk for injury. Question number 6. The part of the ear that contains the receptors for hearing is the A. Utricle. B. Cochlea. C. Middle ear. D. Tympanic cavity. The answer is cochlea. Question number 7. The ear bones that transmit vibrations to the oval window of the cochlea are found in the A. Inner ear. B. Outer ear. C. Middle ear. D. Eustachian tube. The answer is C. Middle ear. Question number 8. The nurse has noted that the physician has a diagnosis of presbycusis on the client chart. The nurse plans care knowing the condition is A. A sensory neural hearing loss that occurs with aging. B. A conductive hearing loss that occurs with aging. C. Tinnitus that occurs with aging. D. Nystagmus that occur with aging. The answer is A. A sensory neural hearing loss that occurs with aging. Question number 9. The nurse is performing a voice test to assess hearing. Which of the following describe the accurate procedure for performing this test? A. Stand 4 feet away from the client to ensure that the client can hear at this distance. B. Whisper a statement and ask the client to repeat it. C. Whisper a statement with the examiner's back facing the client. D. Whisper a statement while the client blocks both ears. The answer is B. Whisper a statement and ask the client to repeat it. Question number 10. During a hearing assessment, the nurse noted that the sound lateralized only to the client's left ear with the Weber test. The nurse analyzed this result as A normal finding, B. A conductive hearing loss in the right ear, C. A sensorineural or conductive loss, D. The presence of nystagmus. The answer is C. A sensorineural or conductive loss. Question number 11. The nurse is caring for a client that is hearing impaired. Which of the following approaches will facilitate communication? A. Speak frequently. B. Speak loudly. C. Speak directly into the impaired ear. D. Speak in a normal tone. The answer is D. Speak in a normal tone. Question number 12. Bleeding from the nose is called A. Hemoptysis, B. Nosophilia, C. Hypostatus, D. Epistaxis. The answer is D. Epistaxis. Question number 13. Is associated with nasal bleeding A. Low blood pressure, B. High blood pressure, C. None of the above, D. All of the above. The answer is B. High blood pressure. Question number 14. What structure divides the nose into two main cavities? A. Nasal septum, B. Meninges, C. Nasal turbinate, D. Nasopharyngeal membrane. The answer is A. Nasal septum. Question number 15. Common onset cause of septal perforation is A. Trauma, B. Syphilis, C. Lupus, D. Blood disease. The answer is A. Trauma. Question number 16. Nose bleeding is not associated with which of the following conditions? A. Malignancy, B. Hypertension, C. Tropical living, D. Renal failure. The answer is C. Tropical living. Question number 17. What is the best initial treatment for a child with nose bleeding? A. Surgery, B. Cocaine, C. Nasal packing, D. Immobilization. The answer is C. Nasal packing. Question number 18. The site of bleeding is established and the patient is packed. INR is 4.5. What should be the next course of management? A. Hold Coumadin and give vitamin K. B. Hold Coumadin and give FFP. C. Hold Coumadin and give FFP and vitamin K. D. Continue Coumadin. The answer is B. Hold Coumadin and give FFP. Question number 19. Which of the following is not used as surgical options for treatment of nose bleeding after other treatments have failed? A. External carotid artery ligation, B. Internal maxillary artery ligation. C. Sphenoplatin artery ligation. D. Middle alveolar artery ligation. The answer is D. Middle alveolar artery ligation. Question number 20. Which intervention would the nurse anticipate to be prescribed initially? A. Irrigation of the ear. B. Instillation of diluted alcohol. C. Instillation of antibiotic ear drop. D. Instillation of corticosteroid ear drops. The answer is B. Instillation of diluted alcohol. Question number 21. Ear wash is indicated in the following conditions except A. Wax. B. Pus. C. Impacted foreign body in the ear. D. Caloric test. The answer is C. Impacted foreign body in the ear. Question number 22. The following are possible complications of ear wash except A. Perforation of the tympanic membrane. B. Paralysis of facial nerve. C. Caloric reaction. D. Syncope. The answer is B. Paralysis of facial nerve. Question number 23. A nurse would question very well in order to irrigate the ear canal in which of the following circumstances? A. Ear pain. B. Hearing loss. C. Otitis externa. D. Perforated tympanic membrane. The answer is D. Perforated tympanic membrane. Question number 24. Which of the following interventions is essential when installing cortisone suspension to get right ear? A. Verifying the proper client and route. B. Warming the solution to prevent dizziness. C. Holding an emesis basin under the client ear. D. Positioning the client in the semi-fowler position. The answer is A. Verifying the proper client and route. Question number 25. A collection of skin cells in a sac within the middle ear is A. Cholesteatoma. B. Cholestasia. C. Cholestanols. D. Cholestanol. The answer is A. Cholesteatoma.